Go ahead and call to order. Call to order the open session of our Board of Directors meeting for October. Will legal counsel read us out of closed session, please?
Yes, thank you. The board considered 3 items in closed session this evening. The first was a hearing under Health and Safety Code 32155 regarding the corporate compliance report. There was no reportable action. Next were the approval of closed session minutes. Those were taken separately. The first one regarding the September regular meeting was approved on a 4-0 vote with 1 abstention by Director Barnett, who was not present. The other item, which was the special meeting minutes, was approved on a 5-0 vote. And finally, the medical staff credentialing was approved on a vote of 4-0 with Director McGarry absent.
Thank you. Are there any deletions, corrections, or adjustments to our posted agenda? Okay, hearing none, we'll move on to audience input. And this is an opportunity for members of our audience to address the board, knowing that we will not be able to have any discussion unless it's been agendized. But you do have 3 minutes to present whatever item you want to talk about. I do apologize ahead of time if I have to wrap you up quickly because your 3 minutes are up. If by chance you are not here to speak, you can always send a comment to our clerk at Tahoe Forest, and she will distribute it among the directors. So with that said, do I have any input from our audience? Okay, hearing none, we're going to close audience input, and then we're going to move on to input from our Employees Association. Do I have any members of our Employees Association here to speak? Okay, I hear nothing and I see nothing, so we'll move on to acknowledgements. And we have Alex McLennan, the Chief Human Resource Officer, to tell us about the Employee of the Month.
Yes, thank you very much. This month, I'm honored to announce that Ryan Caston is October Employee of the Month. Ryan's been with the health system since 2019, and here are some things that his coworkers have to say about him. Ryan exemplifies teamwork. He helps out in any way he can. Another said, he provides such great care to his patients that patients and families alike request him by name to come and sit with them and help them move around their rooms in the ICU. Ryan played an instrumental role during COVID in the ICU with his ability to multitask while still providing the best quality care. Ryan is a great team player and asset to our organization. And another said he is voluntarily helps without being asked, and he's always professional and personable. Both patients, family, and staff all love him. So give it up for Ryan Caston, who is in the audience, and I'd love to open it up.
Woohoo!
Any words to say?
Hey.
So Ryan, do you want to turn your mic on and say anything?
I just wanted to say hi and thank you, everybody. I appreciate it. Thank you, Alex. Yeah, it's a pleasure to work here. And I was really excited and very honored to get Employee of the Month. So thank you all so much.
I don't know if you remember, you guys, he is a patient care tech in the ICU. So he has been challenged for the past, 20 some months with all the things that are going on in the ICU. And Ryan, were you one of the first ones that became a patient tech in the ICU? Or have there been others?
There's other techs, yeah. There's a couple that have been around for a while, and yeah, I'm kind of new, so I've been here for about 1.5 years, 2 years. Yeah.
Well, thank you for all that you do in the ICU. It is quite the challenge, especially as a tech.
Yeah, couldn't do it with all the great doctors and nurses and everybody else on the team. Like they do an awesome job. So it's a real privilege to work with everybody.
Well, thank you again.
Well said.
Thank you.
We have another award that Mary Brown, our director, I'm sorry, before Mary does hers, Ted has an award that he wants to tell us about.
Thank you, Chair Wong and directors. This is an award given late last month by the Truckee Chamber of Commerce at their annual awards event. It was presented by Deidre Walsh, the general manager of North Star, and I thought I would share with you what she said as she presented the award. The award was for Truckee Resilience. Finalists in the category were the Cedar House and Sierra Community House and Tahoe Forest Health System. Resilience is adapting well in the face of adversity again and again and again. Tonight's winner has played a huge critical role in our community during this pandemic. They've responded quickly, sometimes taking on roles outside of their usual purview. We can all agree that none have been taxed as much as our healthcare system, and we are proud and profoundly grateful for everything they've done. They set up the first COVID testing center. They took quick action with the creation of a COVID unit, anticipating a potential surge. They purchased refrigeration equipment for the county's supply of vaccines and built and operated the first and initially only vaccine clinic in Eastern Nevada and Placer counties. They set up a clinic and vaccinated over 650 TTUSD employees in one day, not once, but twice. They've had rapid communication to the community, and they've provided strong leadership to ensure the health practitioner team is supported and the institution is able to provide all aspects of healthcare to our community. And with that, they recognized the incredible dedicated staff and leadership of the Tahoe Forest Health System. And I, this afternoon, stole the award from Harry's office, from admin. I hope you can see it. This is it. And then it has the plaque on the side, and it is in administration. It was a wonderful evening. I'll turn it back to you, Chair Wong, if you have any additional comments. It's my pleasure to do this tonight.
I was very fortunate to be able to attend that event, and it was pretty interesting. It was outside at one of the hangars at the airport. But I do have to say that for the Resilience Award, initially there were 20 potential winners, and then they got it down to 3, and we were the top of the 3. So it was a great experience. And I do have to say, after we were given the award, so many people came up to me personally just to thank the health system for all that we've done. And I mean, people that I don't even know would be coming up and congratulating us on it and thanking us. So again, it was a wonderful honor from the chamber.
So I would add one thing, so that the resiliency of the health system and everyone coming to work is really important. And I feel a little uncomfortable that too much of it goes to the physicians and nurses, but for the hospital to stay open during this time, we need housekeeping and registration and engineering and in IT. We need everybody who shows up. And so when people do congratulate us, I want to make sure that it's going really to everybody who shows up at work. The hospital wouldn't function if dietary or housekeeping didn't show up. I mean, even just a single department off the side. So it's a little awkward that the actual healthcare providers get all the credit, but we really need everyone doing it.
Absolutely.
Good point.
And we will certainly share that as an award for the entire health system, because like you say, one of us can't do it all. And we need every person to do their job well in order to be resilient.
And that
So
was
thank
the
you.
intended purpose of the chamber. I can share with you that. They
Okay.
intended the entire staff.
So thank you, Dr. Lane, for bringing that up. We'll move on to our next award, and our Director Brown will give us the one on the Chief Information and Innovation Officer Award.
Okay, everybody, hold on. It's going to be a real shock. Drum roll. I'm truly honored to read this recognition that once again has been received by Jake Doris from the Becker Hospital Review. So I'd like to read it at this time. When it says Tahoe Forest Health System is pleased to announce that Jake Doris, Chief Information and Innovation Officer, was once again recently named to the 102 Hospital and Health System CIOs to Know 2021 list by Becker Hospital Review. The list features some of the most impressive health IT leaders who lead technology and health initiatives for hospitals and health systems across the country. Mr. Doris has led the IT department at Tahoe Forest Health System since September 2014. Under his leadership, Tahoe Forest Health System successfully transitioned to a single electronic health record platform, providing better coordinated care and modernized its infrastructure, improving the network performance across the health system's 2 hospitals and multiple specialty clinics. And so, you know, while we're not surprised, Jake, that once again you have received this award, we are no less proud. And so once again, congratulations on the recognition, and thank you for all that you do.
My pleasure. It was touch and go this year. I didn't know what was going to, there wasn't a lot of meeting of the CIOs in the last year and a half, so I didn't know what was going to go on with the list, but I was happy to see that we were recognized again. And again, echoing Dr. Lane's comments, it's a team effort. If we didn't have the strong team and the folks that we have working here, then these type of awards that are ancillary to our regular jobs, I don't think would be as prominent. But I all credit to the team and all credit to this organization that allows us to be the best that we can be. So thank you very much.
Thank you, Jake.
Thank you. Thanks, Jake, and we are so proud of you.
Thank you.
October seems to be a month of appreciation weeks, and there were several of them, and I'll just go through them rapidly. But I do want to recognize, as Dr. Lane said, there's everybody in the organizations that need to be recognized, because without them, we could not always do our job. So the first one was October 6th to the 12th, that was National Physician Assistant Week. And we recognized the physician assistants and its contribution to the national health. This week, the Physician Assistant Week, honors all that the physician assistants do for their patients and their communities in all the ways that they add value to healthcare. Our second week of recognition are for those national case managers. And this week was October 10th through the 16th. And we recognize and show appreciation for case managers and transition of care professionals across the country. This official National Case Management Week, the theme was case management, care, compassion, community. 2020 was different. Healthcare professionals from across the country were and continue to be challenged by a multitude of obstacles. With each challenge, we have heard countless stories of case manager professionals stepping up, not back, to positively impact patients across the care continuum. And we want to thank them for their effort and their expertise and their dedication to compassion. Our next appreciation week was October 10th through the 18th, and this was Emergency Nurses Week. And this year, the theme was emergency nurses, persistence, their passion, their grit. Grit was selected as this year's theme to highlight how many emergency room nurses take on their career. They stand in the face of adversity. They keep pushing forward. They're willing to get their hands and scrubs dirty to provide the best possible care for their patients. Even amid an ongoing public health crisis, emergency nurses still don their scrubs and personal protective equipment to care for those who are in need. Our next week was for advanced practice providers, and that was October the 11th through the 15th. And this week not only looked at the nurse practitioners and the physician assistants, but also certified registered nurse anesthetists, clinical nurse specialists, and certified nurse midwives, and all that they provide to our patients and especially to the vulnerable populations, that they continue to receive high quality evidence-based care. Then we had the International Infection Prevention Week, October 17th to October 23rd. And their theme was make your intention infection prevention. So remember that. And then we had Healthcare Quality Week. And again, we know how much those healthcare quality professionals have done to improve the kind of care we provide to our patients. And then lastly, and this goes to what Dr. Lane had talked about, it's Healthcare Facility and Engineering Week, October 24th to the 30th, 2021. And this year's theme for them was Engineer to Make a Difference. Every year in the last week of October, we celebrate the important role that facility team members have in ensuring a safe and efficient environment for all patients, residents, visitors, and staff within the hospital. So those engineers also save lives. So that's October for you and all the people that make our team the great team that it is.
A lot.
Yeah.
Now, Dr. Lane, you have the floor again with your executive committee consent agenda.
All right, Dorothy, can you help me out and put something on the screen, please?
Sure, let me go ahead and share my screen here. So here was the list, and I can go into any individual document if anyone would like to.
So our last meeting was a week ago. We have a new policy on stroke alert. So how we deal with stroke patients when they hit the emergency department. It talks about both the treatment as well as what do we do when, what is the process when they arrive in the department, who jumps in, what do we do? Abby Young, who's the emergency medicine director at Incline and one of our main docs at Tahoe Forest, has really taken the lead on this. She's done a great job. This was approved by MEC. We do have now a reimplantation policy for contaminated tissue. How do we handle it? This has already been approved by surgery. And then we had some policy with some minor changes, death determination. How do we determine someone's dead? Annual neonatal approval, that went through with no changes. Blood alcohol evaluations and testing when law enforcement comes in, which they do very frequently, unfortunately. And EMS diversion, meaning when can our hospital, and it's usually the emergency department, go on diversion and divert ambulances away from us. And it's very limited. The maximum we can do is 2 hours at a time. And then if you need to go further, it's an additional 2 hours. And it covers things such as we're not going to take trauma or strokes if our CAT scanners are down, or if the hospital's overwhelmed, or if there's some type of a engineering emergency, we lose power, et cetera. And then with OBGYN, I believe they only added some outpatient privileges to their policies. So none of it was very groundbreaking, and MEC has approved all of these.
Okay. So just for Bob's edification, all of these policies have been vetted by all the departments that are involved in them. So it's just not the medical staff committee that looks at them, but nursing and emergency room and surgery. All of those departments have to also approve these before they get to medical staff. So do we have any questions about any of these policies?
I just have a question. First of all, I want to say it. These policies are very interesting. And I was fascinated by issues like death determination and the responsibility for that. Just from a technical medical point of view, I was curious about reimplantation and how that works. I wonder if it would be appropriate to explain that a bit.
The answer is yes, it would. You need a microvascular surgeon. There's a little bit of it that's done in Reno. The vast majority, if we have a significant amputation, is going to be transferred to San Francisco. But so our policy came up with, how do you handle the amputated tissue until we can do a transfer to consider for reimplantation? The vast majority of the things we see in Tahoe, well, everywhere, but especially in Tahoe, are amputation of the end of a finger or end of a toe, and those are almost never reimplanted. Certainly, if you lose an entire hand or an arm, those are under considerations.
And
Yeah,
I
fast-
think specifically this policy discusses when we take a piece of tissue, either from your own body or we have brought in a piece of tissue to use, and that piece of tissue gets contaminated somehow in the operating room, and we still want to be able to use, for instance, your tissue or the tissue we specifically brought in for surgery. What do we do to ensure the safety of placing that tissue inside your body in that same operating room situation? And that's kind of what this policy is all about, and how to make sure that we can ensure safety and low infection rates and all of that kind of stuff, but still be able to use that tissue that was harvested for that surgery.
And so, Dr. Cole, did an event happen, because it's a new policy?
Shawnee, are you aware of anything occurring that triggered this?
I think that at this point in open session, I think we should just discuss that this is a policy that should be in our health system for any in case this ever happens in the future or in the past, whatever. We need to have a good guideline to at least guide a surgeon, although it is really up to the surgeon on what process they want, and that's clearly also stated in this policy.
Thank you.
So I think when I read it, I did not, Shawnee has explained it better. I thought this was more, I didn't realize how it went across. So when we actually have someone who needs tissue reimplanted, like a severed hand, most of that goes to the Ralph K. Davies Center in San Francisco. This is on a, if we have something that gets contaminated here, how do we handle it?
Okay. And like I said, all these policies have gone through various departments for approval before they got to medical staff and before they got to us. So are there any other questions for Dr. Lane or Dr. Cole regarding the consent agenda of the Medical Executive Committee? Okay, hearing none. Then can I have a motion to accept the Medical Executive Committee meeting consent agenda?
I'll move to accept the Medical Executive Committee consent agenda.
And a second.
I'll second, Dale.
Okay, so it's been moved by Director Barnett, seconded by Director Shamlin, that we accept the Medical Executive Committee meeting consent agenda as presented. And a roll call vote.
Director Barnett,
Yes.
Director Shamblin,
Yes.
Director Brown,
Yes.
Director Wong,
Yes.
and
So the
for Edification, Director McGeary is still absent.
So Dr. Lane, your presentation has been approved. So thank you again.
All right.
The next item on our agenda is our consent calendar. And these typically are reports and are of a non-controversial nature. But any board member can pull one if they have any questions or want something explained further. So are there any board members that would like to pull one of these items under the consent calendar?
Alice, I'd just like to report that Mary Brown and I, as Finance Committee members, talked today, and we considered pulling some items, but we are going to have a meeting in early December and discuss these specific issues, and we'll get back to the board on these issues that were of concern to us.
Okay, thank you so much for doing that. If there's no more from our board, do any of our staff members want to pull anything from the consent agenda or the calendar, I mean? If not, can I have a motion to accept the consent calendar as presented?
I would move approval of the consent calendar.
And a second.
I'll second.
Okay, so it's been moved by Director Brown, seconded by Director Shamlin, that we accept the consent calendar as presented. If we could have a roll call vote.
Director Barnett,
Yes.
Director Shamblin,
Yes.
Director Brown,
Yes.
Director Wong.
Yes. So that has been approved. Now, moving on to item 17, we have Brian Montenegro from the MOTMA group to talk to us about the retirement plan and the update from our committee. So Brian, are you there?
Yes, thank you. All that gratitude and all those good deeds makes us a very difficult group to follow, but I will try. Martina, next page, please. So my report here is to you as the board because you have delegated administrative and fiduciary responsibility for the retirement plans to the retirement plan committee. And this is our way of reporting back to you on the work that we've done so that you can provide the oversight to the committee. So we're a little late in the quarter for this, but we have our Q1 and Q2 calendar quarters of the activities that the committee has done and a little postscript positive news. So at our Q1 committee meeting, the committee reviewed the investment performance of all the plans and investments, and we had nothing on removal or nothing on watch list. We reviewed the accuracy of the asset reporting, and we found no errors. On a biannual basis, we want to stop for a moment and look at the investment menu, not necessarily the quality of the funds, but the menu, the new investment products, the regulations, see if they're going to affect in any way the types of investments that we use. And this particular year, we looked at the interest rate environment and our products, and we elected to remove a short-term bond fund as an asset class, not because of the fund, but because of the asset class, in favor of a stable value product due to the historically low interest rates. The simple analysis here is that the stable value was paying probably a little bit more than the bond fund, except the stable value, as its name indicates, has a stable value. It does not fluctuate in price. So we elected to remove the risk and the volatility of the short-term bond asset class in favor of the stable value. We reviewed our annual share class report and our target date funds, which host the lion's share of the plan's assets, now qualify for a lower cost share class of the same exact product. So we removed our Vanguard Target Retirement retail share class in favor of the institutional share class. And the primary driver behind that was Vanguard changed their rules. They had a $100 million minimum. They dropped it to a $5 million minimum. So that allowed us to qualify for it. An update I'll give you next year is that come February of next year, Vanguard is going to merge those two share classes and further reduce the investment expenses. So we dropped it by about a third, and then we'll drop it by about a tenth next year. The committee received Fidelity's annual plan review discussing savings rates, participation rates, and engagement strategies. We discussed their overall education efforts in this new world, this new digital world. We haven't had face-to-face in a while, and Fidelity has stepped up to provide one-on-one virtual counseling to any and all participants that were willing. However, we did look at the beneficiary designations in the prior year. We looked at it again. We only have about 47%, so less than half of our participants have a proper beneficiary designation. So we instructed Fidelity to create a communication effort around that to get more people to properly delegate the beneficiaries for their retirement assets. Next year, we'll have an update on that. And then as ongoing fiduciary education for our committee to make sure that we are the most informed committee that we can be, I presented a fiduciary training module around employee engagement. And the underlying point there is Employee engagement, employee communications, they're not required by law, nor are they fiduciary as long as they are not giving advice. So giving education is allowed, advice picks up a very different liability. Martina, next page, please. In our second quarter meeting, we reviewed the performance of the plan's investments, and we had two fund changes that were really the results of management changes. So the first one, Invesco Diversified Dividend, the portfolio manager abruptly left. There was no transition period out, and Invesco elected to bring in an outside portfolio manager, which is a challenge, and a portfolio manager who did not have experience managing large cap value assets. He was a large cap blend and large cap growth manager. Because of his lack of experience in managing this specific investment mandate, we elected to be conservative and remove that fund from our menu in favor of the JP Morgan Equity Income Fund, which has a long-standing investment team. Similarly, but different, Wells Fargo sold their asset management business to two different private equity groups. Private equity groups have a 2 to 6 year window of trying to turn the profit that they're looking for. They are not long-term holders. They are not going to invest in the asset management business. And now you have two competing factions, which is two different private equity groups. We also saw substantial outflow from the Wells Fargo Small Company Fund. And if you've ever been the last one at the dinner table when the check comes, you know who pays. So we again elected to avoid the private equity challenges that will inevitably come, and we elected to get out before that last check came. And I say that in a humorous way, but to fund all those liquidations, that is funded by the existing shareholders. So there's not a sales charge. The existing shareholders have to incur the difference between the bid and ask spread and all those commissions that it takes to sell the products to generate the money to pay the liquidation. So we elected to get out of that. So two different management changes resulted in two fund changes in the second quarter. Of course, we looked at the plan's record keeping. Everything looked good there. We did our annual fee benchmarking study, and the Fidelity's fees were above bench. Fidelity agreed to reduce their fees by 25%. However, when talking with the committee, we decided that was a wonderful fee cut, but it's been a while since we've done a search, and we considered it to be prudent to take a look at the market and see what the record-keeping market had to offer Tahoe now that you're about $140 million combined. We started that in Q4, and this committee, that retirement plan committee, had a meeting a few days ago. The initial results look like we're going to be able to reduce the investment fees our participants pay by almost half. We're going to go to finals, and we will have Fidelity, the incumbent. We will have Empower, which is the second largest record keeper in the country, and ICMA Mission Square, which is the largest specific dedicated governmental plan record keeper. So we have three very strong finalists, and I do expect Fidelity to come back with further fee reductions. And please keep in mind, those are passed right on to the participants. So any fee concessions that we receive go straight to the participants. And this was really an exercise in prudence. We weren't trying to solve a problem. I believe the entire committee was satisfied with the services we've received from Fidelity. But to be prudent, we hadn't done a search in a long time. We embarked on this search, and the participants will receive handsome dividends in the form of fee cuts of what I expect to be about 50% when we're all said and done. We still have a couple more months worth of work to do as a committee for that, but we'll have more of an update for you next quarter.
Brian, a question if I could, Dale here.
Yeah.
Can you tell us about who's on that committee now?
Yeah, sure. Our fearless leader is Harry. We also have Crystal, and we have Alex, and we have Dee Dee Holmes. I'm not sure if Dee Dee's here today, but that is the 4 people that form that retirement plan committee.
Okay, great. Thank you.
We conducted our annual review of fiduciary insurance, confirming that the fiduciaries, including you, the board members, and the committee members that I just named, have adequate fiduciary insurance coverage in case something goes wrong. And as a fiduciary, we provided fiduciary training around governance and the common fee models that the retirement plan industry operates on. Before I move on to a summary of the plan, questions on the work that we've done so far this year, or including the RFP? That's Q3, but questions? All right, Martina. So summary of the plan, on the left-hand side, we have the salary deferral plan, the 457, and on the right-hand side, we have the employer contribution plan, the 401A. So on the left-hand side, plan assets increased from 69.4 at the end of December to 78.3 as of June 30. As I mentioned, I did not mention. I did. The Fidelity Managed Income portfolio is on watch list now as we review the conservative portfolio and alternative options. What I mean by that is there's not a problem. There's not a portfolio management change, an ownership change. There isn't a fiduciary issue. We're looking at it because it's a bit more conservative than we think is prudent. And when we look at other stable value type products, the real question is, can we improve the yield on that asset class without increasing the risk profile? And we believe that we can. So once we make a decision on the new record keeper or staying with Fidelity, we will move to replace this stable value product with a higher yielding product, which as of today's analysis has the same credit security, but a higher crediting rate. So it'll be a pure improvement on return for participants. As I mentioned, as of July 21, we made those two fund changes, Invesco and Wells Fargo, because of organizational changes, and the remaining investments remain satisfactory. On the right-hand side, we have the employer contributory plan, and plan assets increased from 55.8 at the end of December to 62.2 as of June 30. So yeah, we're looking at roughly $140 million in plan assets. We have the same exact investments in both plans. However, in this plan, we have a participation rate decreased from 84 to 83.4. That's really just a handful of people that opted out. And the average deferral rate increased from 9 to 9.3. So when you get those 2, 3, 4, 5%ers, or the person that was automatically enrolled at 6% who opts out, that's going to bring the lower numbers down, which will increase the overall deferral rate. So deferral rates on average are 9.3%, which is fantastic. The total savings rate was 15. It dropped to 13.9 because we did see some folks drop out of participation and they give up the match. And the matches are anywhere from 4 to 7%, depending on tenure. So losing a couple of people that are on the lower end will actually double the effect because of the match. At 13.9, that is still an excellent number. Most financial professionals say you should save between 10 and 15. Even at 13.9, that is an exceptional number. Next slide, Martina. So generally speaking, I think the plan is well run. The committee is very strong, and I would compliment the board and the committee. You have a decisive group. I work with a lot of nonprofits and several governmental hospitals. This retirement plan committee is a decisive group. There aren't a lot of things that trail from quarter to quarter. And as a person who has to track all that, I appreciate that. Are there any questions about the plan or the search process that is underway?
Brian, I do have a question. Prior to doctors becoming employed, when they were independent contractors, they were not eligible to participate. Do you find now that they are employed by the hospital that they are participating in this, or do they have a special plan option?
Mr. Chairman, I'm not sure I can answer that question. I don't have that level of detail, but Alex might be able to provide a little insight, or I don't know if Dee Dee's here because they're more hands-on.
Most of the employed physicians are participating.
Are they? Okay.
Mm-hmm. Yeah.
Because that's a pretty, of course, there have been big gains in investment gains, but also that's a sizable increase in the plan assets. I just thought perhaps it was due to the doctors coming in.
You know, with interest rates as low as they are, it favors equity markets. And with the exception of a bump or two, we've had 12 years of a bull market.
Yeah. It's been pretty nice.
I mean, it's all the result of your financial consultant. That's it.
Yeah.
Good to have confidence.
Yeah.
Any other questions?
I just
Well,
want to
thanks.
thank you to Brian. Brian has been remarkable to work with, and he keeps us on our toes and makes sure that we do what we need to do. So thank you, Brian, for all your work on this.
Thank you, Alex.
Thanks, Brian. And we'll look
Thank you,
forward to
everybody.
the next report where the bookkeeping prices are going down.
Yeah.
I look forward to giving you that report. Take care, everybody.
All right.
You too. Item 18, and this is approval of resolution to support the Gateway Mountain Center. And Ted Owens will explain this to us.
Thank you, Chair Wong, directors. You have seen this type of resolution before you in the past. This is in support of the Gateway Mountain Center, which provides, it's a nonprofit that provides therapeutic and wellness support for high need and high risk youth in the Truckee-Tahoe area. And they are seeking a grant from the Truckee-Tahoe Airport District's Community Support Fund. And one of the policies of the airport district before granting such funds is that applicants seek to receive 3 endorsements via resolution from other public agencies. And so we were asked, and we have done this very same type of support last year and the year before. It would become your resolution would become a part of their application to the TTAD. And if you choose to support that this year, I would need it signed Chair Wong tomorrow, even if I have to drive it to you because it has to go in with the package. So with that, I will turn it back over to you.
Okay. And again, this is a resolution to support Gateway receiving the grant from the airport. That's all we're
Precisely.
doing is we're supporting them verbally. So any questions about the Gateway program or the resolution from our board?
I'm unfamiliar with the Gateway Mountain Center. Is there somebody who could explain to me a little bit how that program works? In other words, do they have social workers that counsel kids? Where are they located? What sort of programs do they run? I mean, it doesn't have to be a lot, just a little background information.
Yeah, I can do that. They're a local nonprofit. I believe they're based here in Truckee. And they sought to, when they created the nonprofit, to fill a gap that was not being served by Placer or Nevada County with respect to youth that were in crisis or suicidal, having other mental or behavioral health issues. And so that is the role that they've taken in the community. We do support them as an organization as well. And so do Placer and Nevada counties, but they are a nonprofit, so they are always seeking additional funding for their programming. And I think that's, I think what they're trying to do with this particular one is increase the wellness center with staff, including a full-time case manager and family advocate to add to their program. That's the type of work that they do.
And Ted, we have supported them in the past, have we not?
Pardon?
I say we have supported the airport in this resolution in the past, have we not?
Yes, we have.
Yeah.
And Bob, the Gateway is located in Truckee and it's on Donner Pass Road.
Okay. Yeah, sounds like a great program. I mean, I think supporting that is a wonderful way to improve our community. And some of those kids have a tough time. So having somebody to go to is important.
Yeah.
Is there anybody from the audience that have any comments on the resolution? If not, we'll go on to a vote to support the resolution. And this resolution 2021-05 to endorse Truckee-Tahoe Airport District funding support of the Gateway Mountain Center expansion plan, serving high-risk youth in the Truckee-Tahoe community. So can I have a motion for that?
I move that we accept the resolution.
Could I have a second, please?
Second.
That was
Okay, who
Bob.
was that?
Oh, Bob Barnett seconded it.
Okay, thank you, Bob. So we've had a motion by Director Brown and a second by Director Barnett to endorse or to support the resolution of 2021-05. Can I have a roll call vote, please?
Director Barnett,
Yes.
Director McGeary,
Yes.
Director Shamblin,
Yes.
Director Brown,
Yes.
Director Wong.
Yes. And I'll come by tomorrow, Ted, to sign that.
Okay, wonderful. Thank you.
If you'll leave it with Sarah.
We'll make sure it's there for you.
Okay, thank you again.
Thank you.
We did not pull anything from our consent calendar. Do I have any board committee reports? Okay, no reports. And then as far as closing remarks go, our next meeting in November has been moved because of the holidays, and that'll be November the 18th. Also know in December, that meeting will also be moved because of the holidays. Any other closing remarks from the board?
Chair Wong, there is a special board meeting, I think, on November 15 as well, if I recall, for the external audit purpose.
Okay, I think we all got information on that one.
Yeah. Can you give me the date for the December board meeting? Have we set that?
Martina,
The December board meeting is scheduled for December 16th.
16th, okay.
yeah, several meetings dates have been put out, so don't get confused, because I mean, every other email was about a committee meeting.
Yeah.
Okay, if there's no further last comments or closing remarks, then we're going to adjourn the meeting. Thank you all for coming and participating.
Thank you.
Thank you, everybody.